Hello fellow smile makers, I'm Nasya and welcome to Nuvia Smile Stories, a show where we show you how we've changed the lives of people one smile at a time. Today we are talking about Tony. Tony had severe anxiety when going to the dentist. Now when Tony came to Nuvia, he only had one tooth. So for his procedure, he was committed to quit smoking so that he could get the smile he always wanted. Tony longed for the day where he was able to eventually smile again and ultimately smile for his grandchildren, and says that his life has changed in ways he couldn't imagine.
Well, when I started coming inside to losing my teeth, I just wasn't smiling all the time, and I figured it'd be time to get some new teeth to be able to smile and be able to eat a piece of cob of corn and not leaving a big old line in the middle of it. It's kind of hard to really eat with no teeth because you got to chop everything up really small, and there's a couple times I almost choked on it because I wasn't able to chew it up very good. Probably steaks and a little more hamburger instead of having to have mashed potatoes all the time and cream corn and stuff like soft stuff. I'd like to be able to eat nuts again, and used to eat sunflower seeds and can't eat them anymore, and so it'll be a big change. It affected my grandkids a lot. They kind of laughed at me and stuff, and I had one tooth that I would always, it'd fall out and I'd glue it back in, and they would just kind of look at me like, gross, Grandpa has no teeth, and so I figured it'd be about time to get some new teeth. I didn't want to do dentures because they fall out all the time. I wanted something more of a permanent thing. The last straw is when my last tooth, I was outside in the yard working, and somehow it fell out and I couldn't find it. And I just couldn't handle having just one tooth looking out. And I didn't mind me with having two, but then when I got one, I figured out it's time to get them done and have some new teeth. I think it'll change a lot. I think more people will respect you more and not be so much a hillbilly or a redneck. I think it'll affect me most just with people talking to me and not really looking down on me like I was a drug addict or something like that. I've been accused of that because I have no teeth. And
I'm Dr. Nielsen, and I'm going to talk to you about a patient, Tony. He came into us several months ago. Came in, he's in a lot of pain, had a lifetime of painful decaying teeth. They're always breaking down on him. Didn't know where to go or what to do. Now there's just too much going on for him to go into a general dentist, and he hadn't been to the dentist for many years. He said it was a lifelong thing since he was a kid. He just remembers his teeth breaking down. He's only in his 40s, and he just had a tough go at life with his teeth. And as you can see, all the back teeth on the right side, the few that he has over here, those are just root tips. Nothing on that lower right side. These severe periodontal disease, these teeth are just barely hanging in there. And even the teeth that he has back here, there's no opposing teeth to actually function with. And so he's just eating soft foods, can't really do anything, has trouble speaking because he doesn't have teeth to support his mouth and his way of speaking. So yes, if you don't have an opposing tooth, a lot of times a tooth will keep erupting. So a lot of people think their teeth keep growing. They don't continue to grow. They're once you're an adult, they stay the same size, the same height, the same length. The only difference is a tooth will continue to erupt. So if it's a lower tooth, it'll continue to go out of the bone and tissue until it hits something. This doesn't happen with everybody, but it's pretty common for it to happen. So if you're missing a tooth, you want to get in as soon as you can to get a tooth opposing it. Even if you want to keep all your natural teeth and you're just missing one tooth, what you don't want is because you want teeth to hit like this. if you lose an upper tooth and you have a lower tooth, and it doesn't have anything to hit now, it's just going to keep erupting. So, and there's some cases, sometimes patients come in and they have a tooth erupted so far that it's closing the space above that I need to place another tooth for another dental implant. So in some cases like that, a patient comes in, even though they're just missing one tooth, and they just think they need a single implant to replace that tooth. The lower tooth has erupted so much, now I have to tell them that I can't there's not enough space in the upper, so we have to extract a lower tooth, and now we're talking about 2 implants. It's going to cost twice as much. So it's just much easier if you get in quickly and we're able to place an opposing tooth. That way you don't have what's called a super eruption, is when that tooth just keeps erupting forward. And that's kind of what happened in this case right here, because he had no lower tooth right there. You see all this bone loss, and so it could have been some super eruption that caused that to continue to go to push downward. So he came into us trying to see what we can do, and luckily, even though he has a lot of infection, a lot of bone loss, he has enough bone for dental implants. And so in one day we were able to do this procedure. We put him to sleep. We extracted the remaining teeth that he had, cleaned up the infection, and then placed implants, and then let him heal, and I'll show you the post-op. All right, this is Tony's post-op x-ray. So we extracted all the teeth, we took out all the infection, smoothed out the bone, and we're able to place several implants, and we got some good implant placement. So we placed 4 on top and then 6 on the bottom. So here at Nuvia, when you buy a treatment plan, the standard is to do at least 4 implants on each arch, so it would be 4 on the upper, 4 on the lower. We just do what's best. So you pay one fee when you're in for surgery. If we can fit more implants, we're going to place more implants because it's better for you. We don't charge you more afterward. We don't say it's a sliding scale. We want the best outcome for you. And so in Tony's case, 4 is all we could fit on the upper, but on the lower he had good solid bone. His nerve was very low down here, so we had plenty of room to place more implants. So on the lower we ended up placing 6 implants because it was better for him in the long run. We didn't charge him extra. We don't do any of that. We just wanted him to have the best outcome possible, and we saw that as adding a few extra implants on the lower. And so with this, he's able to get a very stable lower, also a very stable upper as well, even with the 4. And he's very happy with his final prosthetics.
They feel good. It take me a little bit to get used to them, but they feel better. It's nice to have teeth. I was a little nervous on it and didn't know what to expect, but when they put me out, I didn't feel nothing. Didn't even remember getting home. I woke up at home and was like, okay. There was very little pain. I didn't really complain about the pain or anything. I mean, it wasn't bad. I would recommend anybody to come here. Really? And I've got a friend at work that's getting theirs done, and I told him to come to you guys. No, they're just awesome. Treated me like family. Last time I went for my physical and for my CDL, the doctor acted like I did drugs because I had no teeth. And it bothered him, so this time maybe he'll be shocked that I got teeth. Yeah, because usually I'd say tweaker, but they usually lose their teeth, and it runs in my family that we all have bad teeth. My brother doesn't have any teeth and stuff, but he's never going to get any teeth. It's just the way he is. So I've never told anybody that I was coming to get teeth. Yeah, the only ones that really know is my parents, my mom, and my family. A lot of my friends don't even know it. It'll just be interesting to see people's reaction that know me that have no teeth, and now that they're going to see teeth, and they'll be like, oh my gosh, you know.
Thank Thank you so much, Smile Makers, for tuning into the Nuvia Smile Story Show this week. Make sure to tune in next week for another Smile Story. A new smile is a life-changing investment, and here at Nuvia Dental Implant Center, we want your investment to last a lifetime. If you or somebody you know would love their dream smile, make sure to visit www.nuviasmiles.com. Take your free 60-second eligibility quiz to start your smile story now.